everyone, this is Marika and I welcome you all to this new session of Nursing Management with me. So in our previous sessions, we have discussed about categorizing a nursing professionals. We have seen that nursing professionals have different range within a hospital. Some work as the administrator, some work as a nurse manager, some as the head staff nurse, and some as a nursing superintendent. In the very last session, we have discussed about staff nurse, what are the various education qualification of a staff nurse, and what is the prescribed nurse-patient ratio in any public sector which is given by Indian Nursing Council as well as Government of India. In this session today, we are going to discuss the roles and responsibilities carried out by a staff nurse. After we are recruited as staff nurse, what is our major function? What is our major work that we are going to discuss in this session? The very first function, as we know, as a staff nurse, we must carry out is the management of the ward or the unit. So the first thing that we are going to discuss under the roles and responsibility is management of ward. We already know that a ward is headed by a head staff nurse. So we always have a sister in charge who heads the entire department. In the absence of the head staff nurse, it is the staff nurse who carries out the responsibility of the ward in charge in her absence. So the very first role and function of a nurse is to act as a ward in charge in the absence of the real ward in charge. The second important function under the ward that a staff nurse carries out is to maintain the general cleanliness and sanitation of the ward. As a staff nurse working in a particular ward, the nurse must make sure that the ward is cleaned properly and it is safe for the patients. Another important responsibility of a staff nurse within the ward is to make sure that she supervises the Group D employees as well as guides them appropriately. So as a staff nurse, the nurse must also see the functioning of the Group D employees. Another important function of a staff nurse is to make sure that she writes down the diet register according to the patient's condition. She also should make sure that the diet is distributed to the patient according to the patient's condition. So within a ward, we know there will be different patients with different health needs. As a staff nurse, the nurse must know what kind of diet each of the patient must be following and also make sure that the diet is distributed properly at the right time and also should maintain the diet register. Another important function of a nurse is to also maintain the drug register. So different kind of drugs will be used for the treatment of the patient, and it is the responsibility of the nurse to maintain the poisonous drug register as well as general drug register. The next function of a staff nurse is also to supervise the care that is being provided by the nursing students to the patients. So we know that a hospital with a teaching unit will have a lot of students who come for the training purpose. So it is the responsibility of the staff nurse to supervise the nursing care that is being rendered by the students to the patients within the ward, as well as it is her responsibility to make sure that the tasks that are carried out by the students are well supervised. Another important function of the staff nurse is also to be always ready for carrying out the procedure and also to ensure that the trays that are required in order to perform the procedures are ready within the ward, which means she should make sure that the sterilized instruments and equipments are readily available in the ward, the trays are ready for performing the procedure, as well as all the required articles that may be required in order to perform the procedures are in well-functioning manner. The next function of a staff nurse is one of the most important function, and it is to take over the responsibilities and proper information from a nurse who had a previous shift. So we know that nurses have different shifts. Some nurses will have morning, some will have afternoon, and some will have night duties. Different nurses will be taking care of the same patient, and we will also see that many things might take place within that short span of time. Therefore, it is a responsibility of the staff nurse to make sure that she takes proper handover from the previous nurse who is taking care of the patient or who is taking care of the ward. So this may include the information not just related to one particular patient, but the entire ward, the instruments and the articles that have gone out of the ward, or the instruments that are to be received in the ward, the drugs that have been used, the stock of the drug linens, etc. So all of this can be changed from one shift to another. Therefore, it is the responsibility of the staff nurse to take the handover from the nurse working in the previous shift. Another important function of a nurse is to maintain the records and reports pertaining to the particular ward, which may include various different reports. For example, the nurse is required to maintain the case sheet, the investigation report of the patients within the ward, maintains the vital sign charts, input-output chart, and other necessary charts depending on the condition of the patient. Another important thing that comes with maintaining the reports and records of the hospital is to make sure that the medico-legal cases are properly handled and documented well. So it is the responsibility of the staff nurse to make sure that all those documentations are done properly. And also, she should record the day and night orders as well as maintain the ward statistics. So those are the general things that a staff nurse must do for the ward management. The next responsibility of a ward nurse is management of labor room. Let us see what are the responsibilities that are carried out by her in labor room. The very first function of the nurse in the labor room is to make sure that she prepares the expectant mother for an aseptic delivery. Another function that a nurse carries out in the labor room is conducting the delivery or helping the doctors in conducting the delivery, as well as recording the deliveries that takes place in the labor room. The next function that is carried out by a nurse is also assisting the doctors in any kind of obstetrical emergency. The next important function carried out by a staff nurse in the labor room is attending and assisting in conduction of abnormal deliveries. So many a times there can be abnormal deliveries in the labor room. Therefore, it is the function of the nurse to not just assist the doctor in conducting normal deliveries, but also to help the doctors in conducting abnormal deliveries. Another important function of a staff nurse is taking care of newborn and premature babies. The next function of the nurse is also maintaining the records and the reports pertaining to labor room. So within a labor room, the number of births that take place, the weight of the baby, the abnormalities found during the time of delivery, the abnormalities found in the baby, there are so many different things that are to be recorded. And therefore, it is the responsibility of the staff nurse to make sure that all those details are recorded appropriately. And finally, the last responsibility of a staff nurse in the labor room is to make sure that the linens, the drugs, the equipments, and the articles that are required in the labor room is well stocked. And finally, the last function of the nurse working in the labor room is to make sure that she indents and procures all the equipments, drugs, linens, articles that are necessary for the labor room. Along with the general ward and the labor room, the nurse also carries out special function in intensive care units and burn units. Let us see what are the functions that she carries out in specialized unit. The very first function that is carried out by a nurse in specialized unit is to make sure that the articles that are required, the equipments that are required is available within the units. For example, so in ICU or critical care unit, we know that there are a lot of equipments that are necessary to support the patient. Therefore, it is the responsibility of a nurse to make sure that those articles and equipments, drugs are available within the unit to provide assistance to the patient. For example, emergency medications or oxygen cylinders. In specialized unit, the nurse must also be able to carry out and operate ECG, EEG, and cardiac resuscitation, or at least must be able to assist the doctor in performing those procedures, as well as operating the machines to carry out those procedures on the patient. The next one that we are going to see is management of psychiatric unit. In the psychiatry unit as well, staff nurses play many different roles. And the very first function of the staff nurse is assisting the doctor in the admission and discharge procedure of the patient. We are already aware that the admission and the discharge procedure of the patient who are mentally ill is not similar to the ones who have medical or surgical illness. And therefore, the staff nurses in the psychiatric unit are responsible for assisting the doctor in both admission and the discharge procedure. Another important function that is carried out by the nurse in the psychiatric department is preparing the patient for ECT. Electroconvulsive therapy is one of the major forms of treatment given for psychotic disorders, and therefore it is the responsibility of a nurse to make sure that she prepares the patient for ECT. Not just ECT, for a mentally ill patient, there can be various different kinds of therapies and other ways of treating the mental illness. And it is the responsibility of a nurse to make sure that she prepares the patient for all different kinds of therapies and treatment. Another very important and interesting function of a staff nurse in the psychiatric unit is management of aggressive as well as suicidal patients. So we know that mentally ill patient may have suicidal thoughts, or they may be very aggressive because of their illness. And therefore it is a responsibility of a nurse working in the particular unit to make sure that she is able to manage aggressive as well as suicidal patients. And the very last function of a nurse working in a psychiatric unit is to maintain the proper records and reports of the unit. In psychiatry department, the recording of the data is very important, and therefore the nurse must maintain proper documentation, must do a proper recording of the events of the ward statistics as well as all the different records that are to be maintained. So these are the various functions of a nurse carried out according to the different units where they are allotted. Along with carrying out the functioning that are given to them, taking care of the patient, maintaining the records and reports, making sure that the cleanliness of the ward is maintained, making sure that everybody is carrying out their responsibilities properly, the nurses also plays an important role in education. Let us see what are their educational functions. The very first function of the staff nurse in terms of education is to help the new staff as well as the student to be oriented to the ward as well as the entire hospital. So orientation of the new staff and student is one of the major functions that is carried out by the staff nurse. The next function of the staff nurse is to teach and guide the Group D workers on how to handle bedpans and urinals. So it is the responsibility of the staff nurse to train and teach the Group D workers in handling all those things within the ward. Another important educational function that is carried out by the staff nurse is to teach the patient or a group of patients about various health-related things. As a staff nurse, the nurse may have to teach one patient related to the disorder, related to the treatment, or she may also have a group of patients who can be taught altogether about various topics related to health. And therefore, the staff nurse must provide education to individual patient as well as group of patient on various health-related topics. Another very important function of a staff nurse is to participate in clinical teaching method. So as a staff nurse working within a ward, the staff nurse plays a major role in helping the students learn various things that happens within the ward. So it is the function of the staff nurse to make sure that she teaches the students well. The next important function of the staff nurse is to provide demonstration whenever it is required. So as a staff nurse, the staff nurse must be able to provide demonstration for the students in the particular ward to learn as well as for a new joinee to learn the procedure. Another important function of the staff nurse is to participate in in-service educational program. We have already discussed how important is in-service education and why is it important for staff nurses. So staff nurses must participate in various in-service educational program that is provided within the hospital. And finally, it is the responsibility of the staff nurses to make sure that she participates in various nursing programs as well as provides assistance for the medical researchers. So these are the various educational functions that are carried out by the staff nurse. This brings us to the end of today's session where we have discussed about staff nurses, where we have seen who is the staff nurse, what are the various education qualifications, and what is the nurse-patient ratio that is to be followed in public sector hospitals, and the various roles and responsibilities that a staff nurse carries out within the hospital in different wards, as well as the educational function of staff nurses. I hope the class was helpful and I'll see you all in the next session. Thank you and have a great day ahead.